Owner, founder, primary provider at Desert Star Family Planning Clinic in Phoenix, Arizona. Welcome to Well Woman Wednesdays. I want to give people some time to see the notification and know that we are live. And I do have people watching the chat for me too, so I can catch any questions that might come through. So definitely feel free to interact with us today. My topic today is miscarriage. And this is a topic that has come up a few times recently in my practice. I do provide miscarriage management, and it can be a really big source of concern for people, as the loss of a pregnancy can be very hard. And oftentimes people wonder about why it happened or blame themselves. And I want you to know that early pregnancy loss is common, and it is not caused by exercise, stress, or sex. Most miscarriages happen because the fertilized egg does not develop normally inside of the uterus. And 15 to 20% of clinically recognized pregnancies end in miscarriage. And these are the pregnancies that we know exist, right? This doesn't account for those times where someone's period is a couple of weeks late and then comes on very heavily. Was that a pregnancy? I've had these conversations with my own patients. Pregnancy tests can become positive so early now. You can have a positive pregnancy test before you've even missed your period. And so I'm seeing that in my clinic, and I'm having conversations with people because they're coming in to confirm the pregnancy, and then a couple of weeks later, before they even make it to their appointment, now they're having heavy bleeding, and then their pregnancy test is negative shortly after. And so in this instance where the period was late, you had some heavy bleeding, but you didn't take a pregnancy test, then I would not count that in your pregnancy history as a pregnancy or a miscarriage. However, if you happen to have taken that pregnancy test really early before you even missed your period, and then it's negative, well, that was a clinically recognized pregnancy. And so that then would count as a miscarriage. And I hope that's making sense to you. 1 in 4 womb-bearing people will experience a miscarriage in their life. And so I want to help you a little bit about the terminology of this and a little bit of the science behind it, to hopefully help you understand this a little bit better. Now, the first thing that I want to express here is that the medical term for a miscarriage is spontaneous abortion. So all of these terms that I'm going to describe to you right now have the word abortion in them. Well, not all of them, some of them. So the first thing I want to talk about is something called an embryonic pregnancy. And this occurs when a pregnancy is very early on and appears normal on ultrasound. But then as it develops, a visible embryo never forms. And so by the time a pregnancy reaches 6 weeks beyond the last menstrual period, on ultrasound, we should see an embryo. And so if that's not the case, then we are diagnosing an embryonic pregnancy. Now, another type of miscarriage is called an embryonic or fetal demise. Now, this is the loss of a pregnancy after it has developed to a stage where the embryo or fetus has developed, but we don't see a heartbeat on the ultrasound. And so this has also been called a missed abortion. Now, I just want to take a step back and say that the heart is a very primitive structure this early in pregnancy. And we can see the flutter of the heart as early as 5 weeks of pregnancy. And so there is a lot of emotion and sentiments, feelings attached to the heartbeat, but it is very primitive and does occur very early in pregnancy. Now, in embryonic pregnancy or embryonic or fetal demise, these diagnoses are generally determined by ultrasound, and it occurs before very significant pain and bleeding happens. So maybe a person went to their first prenatal visit or went to an abortion consultation, and then this diagnosis was made because an ultrasound was performed at that time. Now, it is not unusual to have light spotting or bleeding during the first 12 weeks of pregnancy. In some cases, this is normal, but it can also be a sign of a possible pregnancy loss. This is called a threatened abortion. And at this point, the healthcare provider may not be able to tell you what that vaginal bleeding means. It could be a normal sign of early pregnancy, or it could be a sign of a miscarriage. And if a miscarriage is going to go forward, there is no process that can stop this threatened abortion. Now, the next term I want to describe to you is called an inevitable abortion. And what that means is the cervix is open and the passage of the pregnancy is imminent. It hasn't happened yet, but it is going to happen. And this can be diagnosed by ultrasound, also by a physical exam. And once this is determined, we cannot predict for you how long the process is going to take before the pregnancy actually passes. And this could take up to several days or a couple of weeks. And then finally, I want to describe something called an incomplete abortion. And what that means is that there's been some cramping, there's been some bleeding, some fetal or placental tissue has passed through the cervix, but there is still some fetal or placental tissue in the uterus. And this can be confirmed by a physical examination or by an ultrasound. And so wherever you are in this process, there are some treatment options for you. And there are also some ways for you to care for yourself at home as things are kind of moving along here. And so first I'm going to talk about what the options would be once any of these diagnoses are established. The first thing is watch and wait. As long as you're not having heavy blood loss, as long as you're not having fever, weakness, or other signs of infection, you can let the miscarriage follow its own course. And I will give a little bit more information on how you would do that at home. Now, medical management is available. And medical management involves a combination of medications that will cause the cramping and bleeding to go ahead and expel the pregnancy. And then there's surgical management, and that involves the gentle suction to remove the pregnancy, the abnormally growing pregnancy from the uterus. And these options are generally employed. The medical and surgical management oftentimes are necessary for the embryonic pregnancy and for the fetal and embryonic demise that has been diagnosed prior to there being any signs and symptoms experienced by the pregnant person. My experience has been in research also has shown that if any of these two embryonic or fetal demise are going to spontaneously resolve on their own, it's usually going to be the demise We found that these embryonic pregnancies could just go on for weeks and weeks and weeks, and not pass spontaneously. And so you're most likely to need treatment for that. Now, when you're having an inevitable abortion or an incomplete, then these are generally going to pass on their own. And oftentimes, though, people decide that they want treatment because they don't want a prolonged process. Because again, it can take weeks sometimes for the pregnancy to completely resolve itself. And so that can be days and weeks of pain and bleeding, loss of productivity, etc. And so I want to give you some information about how to care for yourself at home if you've had a positive pregnancy test and you're cramping and bleeding and you believe that you're having a miscarriage. And so as long as your bleeding is similar to a period or not very much heavier than a period, then and you don't have other conditions that would make it unsafe for you, like you already have anemia, which is a low iron level. It's probably not a good idea for you to have a significant amount of bleeding at home without medical attention. But otherwise, if you're an otherwise healthy person and you want to see if this process will resolve itself without you going to seek care from a healthcare professional, then what you're going to do is you're going to use pads, not tampons. You're not going to have sexual activity while you're bleeding because those things can increase your risk of infection. You're going to take a nonsteroidal anti-inflammatory pain medicine like ibuprofen, Advil, Aleve. Those generally work better on the cramps of the uterus than Tylenol. Now, if you can't take ibuprofen, gosh, I'm always sad when I see someone with an ibuprofen allergy. Then Tylenol is your option, and then also too, you can alternate between the Motrin, ibuprofen, etc., and the Tylenol for enhanced pain management. You may continue to have cramps for several days after the miscarriage is complete. You can also have spotting for several days after the miscarriage is completed. That's normal. And also, you can start to return to your normal activities once you feel like it, so let your body tell you what you can do. You should, though, avoid really heavy exercise until the bleeding stops. And that's just because you'll just have a bit more crampy, just more discomfort and bleeding potentially if you don't take it easy the first few days as you're going through this process. So when to call for help? Always call 911 anytime you feel like you need emergency care. So that's a given. However, if you notice sudden severe pain in your abdomen or pelvis, or you pass out or nearly pass out, or you have severe vaginal bleeding. And so what is severe? So you are soaking, completely soaking, front, back, side to side, what am I trying to think of the word? The really heavy, when you have a really heavy period, super pad. You're soaking a super pad front, back, side to side, more than two of those an hour for 4 hours straight. Once you've done that, that is a definition of too much bleeding. And that is an urgent matter. Now, sometimes you might get close to that, but you don't get there. It kind of, sometimes there can be gushes and, and those type of things as the pregnancy is passing. So that's not too alarming, but if you find that you continue to soak through front, back, side to side, those super pads, and that's going on for more than 4 hours, then that's excessive and that requires urgent attention. You also want to seek medical attention if you're noticing that you're dizzy or lightheaded. You haven't passed out, but you're dizzy or lightheaded. You feel faint. That could be a sign that there's been too much blood loss and your iron level is low. The other thing is if you have a new or increased pain in your abdomen or pelvis, sometimes that's a sign that there's an infection starting up, or your bleeding is actually getting worse. So it's slowed down and you're like, okay, I've gotten through this. And now the bleeding has increased. That could be a sign that the pregnancy is still there, that it didn't, either none of it passed or some of it has passed and there's still pregnancy tissue inside the uterus. And if you have fever, and again, fever could be a sign of an infection. So watch closely for changes in your health as you're taking care of yourself at home through a miscarriage. And you want to be sure to contact a healthcare provider if, and this is kind of days out where you feel like the process has completed itself. If you have a new or worse vaginal discharge, that could be a sign of an infection. And also, if you just don't get better as you've expected, like once the process completes itself, you should start to feel better. And so, of course, you want to seek medical attention if that's not the case. And having a miscarriage does not mean that you cannot have a normal pregnancy in the future. It is a very common part of life for people who can experience pregnancy. As I mentioned early on in the talk, 1 in 4 pregnant people will experience miscarriage in their lifetime. 15 to 20% of pregnancies end in miscarriage before they complete the 12th week of pregnancy. And that's probably why we have the tradition where pregnant people don't tell too many people that they're pregnant until they make it out of the first trimester, which is the first 12 weeks of pregnancy, because miscarriage is so common. I do want to end by saying that although miscarriage is common, there are some instances where we do want to do additional medical evaluation to determine if there's a medical reason why. And that would be if you've had 3 early miscarriages in a row, or if you've made it beyond 12 weeks and you experience pregnancy loss. Then those are going to be times where we would like to do an additional evaluation with you to determine if there was a cause of that. And so I hope this information was helpful to you. Again, I'm Dr. DeShawn Taylor. I'm the owner and primary provider at Desert Star Family Planning in Phoenix, Arizona. Definitely check us out. Our website is www.desertstarfp.com, and we are accepting new patients. And so you guys have a great rest of your Wednesday, a great rest of your week, and we'll see you back in a couple of weeks here. Bye.